since he seems a little more uncomfortable with extra people by him, would you think it would be better if you held the plate?
Yeah.
Okay. Just for everyone, including the equipment safety.
Right? You might need your equipment later.
It's just not worth stressing him out.
There you go.
Okay. So what you'll need to do for this is hold the plate just like this, and you want to just position his foot so it's right in the middle of that, and the plate is
Behind it?
in between his 2 feet. Yeah.
Sideways?
But I'm going to need to be right about where your butt is.
Okay. I will move out of your way. Is that the right angle for you?
A little bit more forward. Oh, we got to make sure.
Okay. Just keep a hand on that knee. Perfect.
Is that
Oh, you
need
can try to
forward
get
that way.
You can try to get the front of that hoof in. So.
Is that okay?
See what we can do here. We'll see what we got. Go ahead and pull that plate away and just watch him.
And then the next one we'll have behind his legs like this.
Okay.
You sure it's a video, sir?
Yeah.
Okay.
And then we'll just have everybody kind of step away this way, since he seems pretty happy right there. This here for safety's sake.
Just want to match that up with me. Get it as close as you can. Come here. Is it okay?
Just get it further again.
Inside? Inside.
We're getting it.
I can feel it when he starts to wake up and get down with that. This way?
So push to the inside and turn it a little more. So yeah, there you go. So basically we're shooting 4 opposite angles.
Oops, I don't think that.
I think that we're going to need to
Ready to move that. He's coming off. Okay, if you can get it set up for us again. I want you to bring that in closer to that foot if possible. We can have him. Hold. Grab that plate from her just so that she can.
No, don't fall on us.
You're too big. You're okay. You're just too heavy for us to be stepped. Zach, I'm just a little on the
Are
nervous
you
side.
sure you want to hold me up?
I know it's really fun to be held up. Easy.
He'll probably
Set it back just a little bit.
Oh,
We'll get it on there one way or another.
you're heavy. Okay. Is that okay?
Pull it out just a little bit. See if we, make sure we go ahead and pull that out. And that's out. Grab it.
Ooh, careful now.
He's got some. That's pretty amazing. Okay, I think we've got enough pictures to really be able to tell what we're looking at here.
Talk to
what
me.
We're going to do next is
we'll show you.
we're going to also make a CD so that you guys have a copy of this.
Okay.
The CD will go to me and my husband.
I can
The
make,
CD will go to us.
Okay.
If you have one, do you have one today? Or
yes, I can make several
we're gonna make
copies
them
all the way
That's
around
good.
if that's
That's
helpful.
Thank you.
If you want to, if he's more comfortable just hanging out in the shade over there, and we can show you the pictures and go through everything with you.
Yeah, let me turn close.
Okay. Okay.
around because we don't need him again, right?
No, we don't. We're
see if I
good.
None of this right here is normal. This is not a normal articular surface right in here or in here. And so he definitely has it. He has a lot going against him. You can also see that with this side bone, we've got, there's been reactivity with it, so it's had some inflammation even after the fact. So I think what's happened is he had the side bone because he was trying to stabilize that joint for himself, and then he's had injury after injury to it, causing more reactivity, causing more inflammation, and causing him further lameness.
He
So,
did have 6 that I counted abscesses right along the corner and right in the area this past winter, just one right here.
I'm impressed he hasn't had, that he's as sound as he is for what he's going through. I don't think, like I said before, I don't think that your horse is ever going to be 100% sound.
Well, we're interested in keeping him comfortable.
Yeah, and so I think that there are some other things that we could possibly add. I'm really excited to hear that the Adequan has been helping too. What I think I'd like to add to the Adequan is a drug called Legend.
Legend?
And that's given intravenously. Yes.
Acid once a month or once whatever?
We would have to start with basically, you have to build it up in their system. So it's a once a week shot for 3 weeks, and then it's as needed. Most horses with a problem more like his probably are going to need it like once a month.
Okay, now let me ask you this. It's my understanding that Legend is straight hyaluronic acid, is that right? Do you like Lubricin as well?
I can't say that you're going to necessarily get as good of results.
Probably not, but would it be of any use?
It might be. Maybe
it works for me.
I know some people also will use polyglycol.
Yeah.
And it's also a little bit cheaper. The thing is it's off label. And so what we always recommend, what the gold standard is what's on label. And so then you can take that information and you can certainly try other things if you prefer. I understand cost is always an issue.
Sure.
So, I've got no problem with people trying different things. I know for sure that the Legend does work very well. But I don't even think the Legend's going to make you 100%. If you look in here.
We sent the old X-rays to my vet, and she couldn't tell much from them.
Yeah.
Of course, but she thought that he might have had this might be a quitter. She thought that this was perhaps cartilage rather than from what together. Is that possible?
It's possible.
If so, she said that there was a surgery that one could do to correct it.
Would you consider surgical?
I'm sure we would.
Then what I'd recommend us doing is taking these X-rays and referring him to a surgeon, having them at least take a look at that and look at his history and the background behind him. And then we also have to explain that he's going to be a horse that's going to be a little bit difficult. Because a lot of times, even if we get through a surgery just fine, there's a lot of aftermath, there's a lot of aftercare.
Would he have to be hospitalized for aftercare?
At least for a couple of days. Most surgeons will not release the patient. Plus, it's going to be very, very difficult for bandage changes and such if he's a little bit more of a difficult patient. So he's going to be one that's going to, you're going to have to go a little bit slower, and people are going to have to be made aware of his background because he had abuse when he was young.
I don't think they ever forget anything.
I would absolutely recommend having these seen by a surgeon.
Would you refer Solvang? Would that be one that you would suggest, like Alma
Pintado is one of the best clinics that's out there. Within our vicinity, it is the best one.
Okay.
Mark Rick is a fantastic surgeon, and I would absolutely trust him.
He did surgery on one of our horses at work, and he was awesome. Like, he was willing to work with me and
he's
go.
He's fabulous.
Really great.
I've worked with him many, many times. I've spent a lot of time one I'd go to.
That's what I was curious
So,
about.
very impressive, I will tell you that.
Do you see any sort of infection in there? Any sort of...
At this point, I don't.
That's good.
I just see a lot of reactivity.
So just the inflammation and stuff, that's good.
I think that he's had, injury upon injury.
Oh, I'm sure he has. I mean, the people have had it.
And I mean, in those joints, they're really just unhappy. But I've seen a lot of horses that'll go through surgeries and they can clean them up, and some of them go on to do some great things. So
But he doesn't want to have to do anything.
he just wanted to be comfortable.
Yeah.
I respect and really appreciate that. There's a lot of horses out there that don't get that opportunity. This is our lateral oblique. And so what we're doing is we're seeing that side bone fuses here. It's pretty significant. Yeah, it's very. Those joints are very arthritic, and I imagine this has caused him a lot of pain for many years. He's learned how to handle it. You can see all this reactivity in here. This is got a lot of. He has a lot of discomfort.
What, a shoe or a boot you're going to have to do?
It's possible. At this point, I really think that the best thing for us to do is always to have a surgeon to have them review it, because this is a case that, if we have the options to have somebody else take a look, they've got all the toys, they've got all the big guns out there, they will know what could possibly help him. And so I think what we should do is